Hi, friends. Thank you for tuning in to the Concussion Coach podcast. I'm Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com. Hi, friends. Welcome back to the Concussion Coach podcast. Today, I am excited to introduce you to Melissa Biscardi. I initially became aware of Melissa through an interview that I did with Shelley Vaisberg recently. And Shelley had such good things to say about Melissa that I looked her up and reached out to see if we could connect. And when she responded, she said that she was going to be in Hawaii for a period of time and we could maybe connect afterwards. And I was like, wait a minute, I'm going to be in Hawaii at the same time. Maybe we could see each other there. So kind of really cool and random. I mean, we live in different countries. She's in Canada and I'm in the US, and we got to meet up briefly in Hawaii. And I love that we got to have that touch point meeting in person before we even did our interview together. So I will explain a little bit more about Melissa, and then we'll just jump right in and ask her all the things. So Melissa Biscardi is a concussion clinician, educator, and budding research trainee. She has been a registered nurse since 2006 and an osteopathic practitioner since 2013. She has consistently pursued lifelong learning and maintains a curiosity for the road less traveled. In her clinic, appropriately called Concussion Rehab, she has maintained a brain-wise practice for over 10 years. Beyond patient care, Melissa is a dedicated mentor, guiding new clinicians to adopt best practices in concussion management. Melissa has training from the Carrick Institute and completed a Master of Science that focused on women's specific outcomes after concussion. Her master's research explored persistent symptoms in women suggestive of reproductive hormone disruption, and was the first study to investigate the novel anti-Müllerian hormone in the context of concussions/mild traumatic brain injury. Most recently, Melissa became a PhD candidate at the University of Toronto. Her research examines strategies used in her clinical practice, specifically the use of progressively challenging eye movement tasks delivered via virtual reality goggles. Melissa has published 2 book chapters and numerous research articles. As an advocate for integrating accessible technology into rehabilitation, Melissa developed the Brain Toolkit app for Android and iPhone. When not tied up being a brainiac, Melissa loves hiking and climbing in the mountains and spending time with her family and 3-legged cats. So thank you so much for being here, Melissa. I know that you do love hiking because I saw you on a day that you had just been hiking. We're about to go hiking the next day, so I love it. Welcome. Thank you for being here.
Thank you. I'm so excited, and I love that we got to meet in Hawaii, like so random that coincidence happened.
Yes, it was very fortuitous. I love it too. So we got a good background here, but if there's anything else you want us to know about you, where you're from, what got you interested in helping people with concussions, I would love to hear it.
Sure. So yeah, I started in nursing, and it's been a little bit of a windy road, but some things kind of came together. So in nursing, I've actually focused on reproductive health. So I worked in infertility clinics. And then anti-Müllerian hormone, that actually is the gold standard test for age until menopause, or like how close you are to menopause, but they also use it in fertility testing to see, how fertile you are. And then, one thing I didn't mention is that I'm a 2nd-degree black belt in Brazilian Jiu-Jitsu, and I really competed, I guess you could say semi-professionally, like it really took up a large part of my life. And I met an osteopath through that. And I always thought, I want to be like Daniel. And I talked to him about it, and he encouraged me to follow that sort of dream or desire. So then he became my mentor. Then I did the osteopathic training, and he was already interested in the brain. He treats a lot of like the NHL athletes locally, but my interest in the brain also came sort of organically. Had my own concussion, had some memory issues, and that was around 2013. And then after a couple years, I decided that I would really only see concussion patients or brain-related patients because, if you're getting knee surgery, you want the knee person, the person that is just around knees all day long. And I felt I kind of had to immerse myself to really be able to help people to the best of my ability.
Yeah. Okay. Wow. That's amazing. So tell me, what got you interested? What was so amazing about, was it Daniel you said?
Yes.
Your friend who's an osteopath. What was it about him and what he did that you were so attracted to?
So I met him when I was competing and he would come in and treat the athletes. I actually thought he was a physio at first, so I applied to physiotherapy school. But I was like, wait a minute,
I want to do
not the right
whatever
path.
it is. Love it.
And I love that he was able to blend athletics and rehab. That was even before the brain stuff. And also so if you were to be a fly on the wall in my clinic, I'm very like playful and relaxed and the very welcoming environment, not this whole like white lab coat. I'm the quote unquote professional. And he really had that sort of at ease personality. And it was just really attractive to me to be like, oh, wait, I don't have to just be a quote unquote nurse and follow this traditional path. I can actually blend like my passion for athletics and what I did for work.
That's really, really cool. And so after you did your training for that, is that when you went off on your own? Like, how long have you been doing your own thing?
So I actually did it the hard way. So when I became an osteo, I just started in an independent practice. And that was hard to build my clientele, I guess you would say, or my patient base. And then I was like, okay, I better start to work in clinics to sort of balance this. So I worked at one of my friend's clinics. We actually bartended together in our 20s, and then she became a chiro and opened up her own clinic. Like, I love this. This is
Yes.
like the wonderful world of the universe. So I worked there and a sports med clinic. And then as I got more seasoned and confident, then I slowly let go of those clinic positions, maybe let's say 17, and just was like 100% me.
Okay, awesome. And did you start out, like, you said that you had a concussion yourself? Had you
Yes.
already focused in on concussions prior to that, or was it that experience that kind of led you into wanting to focus that way?
It was that experience and also seeing friends in martial arts. So in Brazilian Jiu-Jitsu, there aren't as many because it's more grappling, but they happen. I did have a couple friends who had it. And then, yeah, I guess I saw Daniel treating them. I started to treat them and was like, this is amazing. Like, I love the puzzle. Well, not amazing for the patients, I know, but amazing that I could help. And it's puzzle work. And that's what I love about healthcare. So every puzzle is different.
Yeah.
And you're always thinking, like, what could be happening with this person in front of me? How can I help? Do I need to refer? I love that. Yeah, my brain always has to be on.
Yes, yes. So cool. I didn't realize that you had a concussion. So before we jump into the other things I want to ask you about, do you want to share a little bit about your experience with the concussion and how that kind of changed things for you?
So there are two pieces to this. One is I had a concussion, but it was sports related. Not that makes it any better, but it kind of does. Like, often sports related concussions, your first one, people will recover smoothly depending on what they were like before. And that was me. I was already dipping into the brain stuff. I got a foot in the head, saw stars, was like, oh no, I'm about to become the patient. Right. So I did all the things I knew to do. Like, it was 1 or 2 days later, I went to see Daniel. But so it was unremarkable. I'll say within 2 weeks, I was back training, maybe not full force, but I was getting into activity in that like ideal time frame. But the good thing is I was able to experience sensitivity, looking at screens, headache, like feeling dazed. And I think that was good for me in terms of having the lived experience that some of my patients are facing. And then aside from that, I actually had this long journey where I lost my memory. And it was independent of the concussion, but it was a much worse experience than the concussion. So I was losing my memory, forgetting who people were, forgetting things that had happened. This is now it's been 10 years, around the same time though, 2013. And, of course I'm dismissed, like, you're stressed. There's nothing wrong with you. All the tests are clear. But it ended up being that I was taking Benadryl like every single day to sleep because I had long time sleep issues. So that's not good for your brain, but I had no idea, even though I'm a healthcare provider, and that interferes with the acetylcholine, or the memory chemical. And then it was just serendipity that I was talking to one of my teammates, and he said, "Oh, did you see that study that Benadryl causes dementia?" Or Benadryl is the brand name, but it's the chemical, right? Dimethyl something or another. It's like, what? Oh my God, I'm literally giving myself dementia.
Oh my God.
So that journey was a lot more complicated for me and really pushed me into the brain stuff.
Yeah. Wow, that is fascinating. I had no idea. Thank you for sharing that.
Oh yeah. So now when, people come in and they take it for allergies and sleep and this and that, and I'm pretty firm in like my recommendation to stop. I'm like, do anything you have to do essentially to get off of that.
Yeah. Wow. I love that you were in an environment where people are like, "Hey, did you hear about this article?" That's like just your world. So
Yes.
that you came across it and now you can share it with other people.
And it's so funny because the sports doctor I saw, he did not care what over-the-counter stuff I was taking or supplements or anything like that. And at the end of the day, that was actually probably the most important thing.
So interesting. So yeah, that's probably something that you take a look at when you were working with patients. Yes. Oh, so interesting. Especially from the nursing background, you would probably know the medication side. Definitely. And so interesting. Super, super interesting. Okay. So tell us, I guess we got a little bit of how the practice came about and what brought you to doing this, but I have so many questions for you. why don't we try to structure it this way? So I want to hear what you do to help people who are dealing with post-concussion symptoms. Like if I were a patient, what would it look like if I came into your clinic? And then I have some more specific things too, but let's start there. What do you do?
So on the first day, people come in, it's probably between 75 and 90 minutes, and it's a big assessment because I have a holistic practice. So I'm really trying to gather as much information as possible to be able to help in a holistic way. And aside from the history, I will do basically a neurological assessment, like looking at the walking, the coordination, but I also assess the eye movements using VR goggles. So getting like a really objective measure. And I can pick things up with my naked eye, but we can really get nuanced and also really track people over time. So I have dipped into the technology piece. So I have something to measure the neck objectively and the force plate. So gathering some objective information. And then I'm assessing the tissue. So what is happening with the whole body? Because we're a collection of injuries. When you get a concussion, it's not just the concussion, it's everything you brought to the concussion. So what history is in that body? And especially looking at the neck, because there's always that whiplash component, but also the cranial tissue and the facial tissue, because they might have been hit in the head, but if not, we still know there's a tissue disturbance there, inflammation, etc. And then I start to make a plan, essentially, and also see who else is in the kitchen working with me, essentially. And, I think it's unlikely that it's just going to be one practitioner that brings you from beginning to end. It's likely going to be a team, and that team might change over time. So also saying, okay, where am I in the journey with this patient, and what are the next steps?
Yes. Okay. That brings me to a question that I am curious about. I know Shelley had talked about how one of the things you were so helpful for her with was being like a guide / collaborator / kind of like a case manager almost in a way for her. So it sounds like that's kind of what you're talking about, figuring out where you are, who else is in the kitchen with you. So how have you developed that? And like, what do you recommend for people if they're like, I don't even know where to start, what to do? Like, what do you tell people to look for?
So one important piece I think is like there has to be a personality match too. So Shelley came in and she's like a real go-getter, literally says I help go-getters on my website, but it's a very energetic relationship. And some people might not even be there in their journey where they're like, okay, I can face this, head on right now. So finding that personality match with your practitioner is important. And then, I really try and give my all, because I've definitely paid a lot of money to see people and thought, oh my gosh, that's all I get for this session. That's not very helpful. And so I try and be as helpful as possible, because sometimes, you might be the only person they're seeing at this time. Or so in Canada, it's basically all out of pocket. There's a little bit of insurance coverage, but I really try and over deliver. So we have the rehab part, but I definitely help with planning for return to work, pacing. I don't want to say I do OT stuff, but I lean in there. What can I do if they're not seeing an OT? How can I help with this? Expectations, a little bit of nutritional stuff. So I don't want to say I go out of my scope, but I really use my scope to the maximum of its ability. Oh yeah, exercise. And again, meeting the person where they're at. So we have the Buffalo protocol, but some people some people don't have a treadmill. Some people can only walk for 1 minute or 30 seconds. And if that's what it is, that's what it is. So meeting the patient where they're at, I think, is really important too. So if you're finding a practitioner, it's okay, is this person just delivering a protocol, or is this person going to be able to meet me where I'm at and bring me forward?
What other professionals do you see people often needing, or, and I'm sure it depends on the person and the injury and what they're dealing with, obviously, but what are some of the range of people that you see or that you refer to?
So I really find naturopaths to be helpful, especially in the chronic stages where maybe there is some lingering hormone disruption. Hormone disruption is really fascinating because it can happen in the acute stage, or it can happen in the chronic stages, but it's not mutually exclusive. So you might not have it in the acute stage and then it comes along later, or vice versa. So if people seem super, super inflamed and we've tried the diet stuff, or sleep maybe is all over the place, persistent disruption in periods, it's okay, let's get some blood work and someone who can work more in a more nuanced way than I can. That's really helpful. Sometimes they'll have a chirophysio, but I'll say that really depends, because I do a lot of manual work, do some vestibular work, can do some acupuncture. So sometimes there'll be an ebb and flow between me and another manual therapist. There should be a physician in the circle if possible. And then, the other big one is mental health support. That's a huge needle mover, because it's a trauma. No matter what, at the end of the day, you've gone through a trauma.
Yes. And I do see that that's a piece that gets missed a lot. So I appreciate you bringing that up. Okay. Again, so many things to ask you about.
I wish I referred to OT more. And actually, I think this is a piece where I talk to Shelley a lot, but there's still, even though I love Shelley, I've talked to her so much, explaining to a patient how the OT can help move the needle if there's not a specific return to work is sometimes hard. It's hard. It's a hard sell.
Yeah.
So I'll work on that.
Great.
Sometimes it's an easy sell, but sometimes it'll help them, but in limited resources, it'll be hard to get the buy-in.
Yeah, it's hard. It's OT is so broad as well that it's hard to say they're going to help you with this one thing, because we do so many things, which I think is a blessing and a curse at the same time in some ways.
Well, one fascinating thing I've learned, because my research is eye movement rehab, and OTs really can participate in that. And there's a study OT led, I think it's called Visual Therapy After Concussion. And there's another article, I think she's a graduate student. It's coming out. And I found her poster online and said, oh my God, is there an article to go with this? So I know the OT, scope is very broad, but can be very helpful if you leverage it properly.
Yes. And the eye piece is a huge part. So let me ask you though for a second. You brought up the hormone disruption thing, and I am very fascinated by this. This is an area that personally I'm very interested in, but I have not learned a lot about yet. So tell me what I need to know, what people listening would be benefited to know about hormones and how a brain injury can impact them and what to do about it.
So we know concussion causes a shaking of the brain and disrupts the cellular balance there. And what can happen with those shearing forces is that the little blood vessels essentially are disrupted, and that can affect the balance of hormones in the system. So growth hormone is actually the most commonly disrupted hormone, but after that, it's reproductive hormones for males or females. So that might manifest as any changes in your period, missed period, extra period, more PMS, premenstrual symptoms. So looking out for that and not thinking you're crazy, like that can be because of the head injury.
Mm-hmm.
And then for males, they will notice because they'll lose their morning erection, but then other thing, and they might not talk to you about it though. So that might be a point of conversation, but also for them, muscle wasting, poor mood can come up. And again, where I said, like, sometimes it'll happen right away and sometimes later on. So that means that we always have to keep inquiring, essentially. Like, have your periods changed? Did they normalize? That's a good question. But this is why I didn't continue with the hormone research, is because for me, I can't actually address it in my practice, right? I can't order blood work. I can't prescribe medications. So you really need a physician and an open-minded physician who is going to dig into that, right, as well, and do some blood work, essentially, because then there are options, like different, I think from naturopath point of view, they would also have some options, but here I know there are different hormone creams that sometimes will be prescribed. I think often, I don't know how it is where you are, but you really have to push for the blood work here, which is crazy because it's covered by that is something that's covered by our health plan.
But people have to push for it still. It's
right.
The medical system.
The other thing, okay, I don't know the research on this, but definitely there can be a disruption in like the glucose regulation. So I noticed with some of my either teammates or patients that then the female ones in particular would faint within like a couple weeks of their initial concussion. And I remember my one like teammate / patient, the doctor said, "Oh no, it's not related." Yeah, there is definitely some research. I just don't remember it all. And I was like, that is definitely related. So I think keeping a keen eye is the most important thing.
Yes. Okay. That is so interesting and so good to know. Thank you for all of this. Well, and it's so interesting. Like you said, it's hard to tease out whether it's a hormone thing specifically or a brain thing. It's all so interrelated and hard
The
to
web, yeah.
So fascinating. So let's talk about some other things. You kind of mentioned them before, but you had I know in your social media, you have a post that's tagged about the must-have tools that you use. And maybe you can tell us like why these are important and maybe give an idea or two from each that could be helpful for our listeners, if that's okay.
Sure.
So so I'll just name them first and then we can maybe talk about each of them if that's okay. So you have exercise, manual therapy, nutrition, nervous system support, sleep, head-eye vestibular therapy, and collaboration. So I'm excited to dive into each of these. And again, it doesn't have to be just a couple of thoughts or like why it's important and what a tip or a trick that somebody could use that might be helpful for them where they're at right now. So let's start with exercise.
Exercise, yeah. So now there's a lot of evidence showing that early movement or exercise is really helpful for recovery. And it really blows my mind that I still get people who say, yeah, I stayed in a dark room. And I was like,
I know.
Possible. But it's
crazy that they're told to do that. That's the thing that like blows my mind. It's like, no, we are so past those people. Yeah. And it's not their fault. It's their providers that are often telling them to do that. Yeah.
Yes. They're not recently informed, I guess.
Yes.
And even if you don't have a heart rate monitor or a treadmill, you can start with conversation-paced walking at the very least. And I think the Letty research says like you can, if you want to get into the math of it, take half of your max heart rate, so 220 minus your age divided by 2. That would be half of your max heart rate. Start there. I guess if you don't have a heart rate monitor, you can't measure it, but it's like easy pace. And then you can increase it by 5% if you tolerate like 3 days in a row. So let's say you're in the bush, no practitioners anywhere near you, you hit your head, it's been 2 days. Like you can just start to move easy peasy, mind your symptoms. And then If you have a practitioner, of course, they can really push you along. But the other thing is, it doesn't have to be walking or riding a bike. We can do like aerobic exercise using light weights or just body movements. So it doesn't have to be boring. And I think that is like an important message. Like, it doesn't have to be boring. You can be creative with your aerobic exercise, but get on it ASAP.
Yes, amen. So important. Excellent. Thank you. How about manual therapy? Tell us about manual therapy.
Yes. So I guess there are different approaches, right? Osteopathy is very gentle. We go layer by layer from the superficial layers. And then I want to say traditional chiro will go straight to the bone, right? Adjust the bone. Not to say one is better than the other, but you might need one approach more than another. In terms of osteopathy, we often do cranial manual therapy, which can be really helpful to help with the drainage if there's a lot of inflammation. And there's research, I want to say less on concussion, but there is research on moderate and severe TBI that would translate, and really interesting results like objective measures, intracranial pressure, edema, stuff like that. I think the gentle stuff can be really helpful in the early days just to help normalize the tissue.
Is that like craniosacral therapy? Is that what you're talking about? Okay.
Yeah, exactly. And then physio, definitely, I want to say they're like the rehab exercise experts. So it's good to get them in the circle too, to get those sort of nuanced rehab strategies.
Excellent. Sorry, I'm going to come back to the craniosacral thing. Can you tell me a little bit about what that is and how it helps people?
Cranial or cranial manual therapy? Yes.
Therapy, yeah.
So cranial sacral is like a trademarked version that is, I want to say almost protocol, like it's a certain sequence that they follow that is really balancing our sacrum, so like our butt, with our brain, and ensuring that our cerebral spinal fluid, which is like our lubricant, is moving effortlessly through our spine and our cranium. And then practitioners who don't have that sort of certification would usually say they do cranial manual therapy, which would be similar. It's very, very gentle. And it's about, so if we think that we need nerve, artery, vein, lymphatic liberated, otherwise it'll be kinks in the hose. So we will do very gentle manual. It almost feels like nothing. Just really, really gentle to help the tissues release and let that blood flow come in, and then the drainage go out.
Cool. Okay.
It's very relaxing too, like, which is nice, especially in the early stages. When you're like, oh my gosh, I'm in pain. Things feel really, really weird. And then you'll get a really gentle manual therapy session, and it'll just help the nervous system come down a bit too.
Awesome. Thank you. Let's move on to nutrition. What do you love about nutrition? What do you share with people?
So we need, the fuel that goes in is so important, right? If you're eating Tostitos, that's not going to be the most nutrient dense. And I think as practitioners, we often take it for granted that we generally eat pretty well. Not that we're perfect. And I think it's important not to assume that of our patients, and educate them like on making healthy decisions, fruits, vegetables, which might seem basic, but it's really important. The hydration, staying away from pop and juice, and also alcohol, which I've learned some people really embrace that in their life, and it can be a hard separation, but educating them that it's really a neurotoxin and it can really set you back if you're having that right after your injury. Or even some people say like avoid it for 6 months. I generally ask people to remove or reduce the gluten because I find it's a needle mover. Like,
really,
like it or not, it often moves the needle. And then I'm a little more flexible on dairy and stuff like that. But a lot of people, after removing the gluten, or like the big ones like breads and pastas, like they'll keep their diet that way because they feel better without it.
Super interesting.
Do you find the same?
I've talked to people. I feel like I've had a variety of ideas that I've heard. But yeah, I think just as a general principle, I think that the less breads and pastas, the better we tend to feel.
Unless we live in Italy, because in Italy, it's like it's made differently.
Yes, except there. So you Italians are lucky. You just keep doing what you're doing.
Like some people will say keto. I don't think there's research published specifically on keto after concussion, but it's hard to maintain. Like that, there's definitely research on other neurological conditions, but I know there's a paper that says the Western diet adds insult to injury, essentially, after a concussion. So just sort of cleaning up your sources of nutrition. And then I usually talk about omegas, magnesium, like some supplement support, especially if they don't eat fish. And the magnesium is good for sleep.
Yes. And
There's so many there. This is why you need to work with a practitioner, I would say, is because there are just so many moving parts that it can be overwhelming.
Yeah. And specific to each individual too. I think, yeah, it makes a lot of sense. Tell us about nervous system support. This is something that I feel pretty passionate about as well. So what do you tell people and why is that important?
Well, like we said, there's the trauma. So your nervous system is on high alert. Like some of the light sensitivity, noise sensitivity is because we are on high alert for that tiger. Like we have a reptilian brain still. So I have a few guided meditations I'll usually give people and some different breathing exercises. I know that the aerobic exercise is always good for the nervous system, but the better or like the more relaxed or homeostasis we can create in the nervous system is going to support healing because we can't heal if our brain and body thinks we're in danger.
Yes.
So that one is really like foundational. I have a little pyramid, how I approach care, and it's like the nutrition, nervous system, and mental health support and sleep are like around, like they're foundational, and then we can start to add other things in.
Yeah, those are very foundational. And so speaking of sleep, let's go to that one. How do you help people sleep, or like what are some ideas that you have that are
Tough one, right?
Yeah.
And okay, so the magnesium bisglycinate, I do like that to support sleep, and melatonin. And with melatonin, it's like 3 to 5 milligrams that is supposed to be the amount for sleep. And when you get to higher doses, it's more antioxidant. So I will talk about that with patients. And if it's really bad, I'll tell them to circle around with their doctor because there is some research that taking the sleeping pill for, I think it's 3 months, which is a little long, but it can normalize your sleep cycle. So if you need a medication to get your body back in its rhythm, I think that can be helpful. Decreasing the screens, relaxation before bed, all of the basic stuff. I do like unplug your Wi-Fi, like try and just get as little electricity happening around you. Which some people might think is hokey pokey, but I've tried it myself. And I feel like I do sleep a little better when all my electronics are off, even just because if our phone is, even if it's on silent, I think in the back of our mind, there's still this on. Like we're like, there might be a message on that phone, even though it doesn't matter. Like it can wait.
Yeah, no, that's super interesting, that like psychological piece, if it's still on in there. Interesting. Cool. Thank you.
What was I going to say? Oh yeah, right after injury, I know people like to take naps, and I'll say you can nap, but you have to make sure you're sleeping at night. Like everything we can do to keep that sleeping at night routine, I think can be super helpful.
Yes, so important.
Any other sleep strategies that you use or can think of?
I know that sometimes people like having the temperature in the room a little bit cooler can be helpful. Maybe turning off overhead lights and having, just lamps if you're going to need light around the house. That kind of signals the body like, oh, okay,
it's time for bed.
Going down. Like the light source is not above me now. So that can trigger things for us. And getting sunlight in the morning can get the sleep cycle going the right way. Yeah, those are a couple. And then one that I really like, and actually use this on the flight home from Hawaii. It was so helpful because it was a red eye that I took. And I listened to brainwaves. I have a brainwaves app. I don't know if you've used those before, the binaural beats. And I've been a believer in that for a while, but like it was especially helpful because I remember being on a red eye a year or so ago, and I was like, I used to be able to sleep on planes, it was no problem at all. And then that flight, I didn't sleep at all, and I was like, dang it, I'm too old, I can't do red eyes anymore. But then I had to do
the red eye. Oh my gosh,
I had to do a red eye for this flight. And I was like, well, I'm gonna just try the try the brain waves. And I actually had done an interview with somebody who had gave lots of tips for traveling with concussions. And so I like was really grateful for that. But so I used that, and like it was extremely helpful for me. I definitely feel like I got a lot more sleep than I ever would have if I hadn't had them. So
That's amazing. I haven't used them myself, but I have had patients use them. And you know what? I have to try them because I have issues with my sleep still every once in a while. So I'll
yeah.
try them and report back.
Yes, please do. Excellent. Awesome. Thank you. How about the head-eye vestibular therapy? This is huge. This is so huge. And I love that you do all of these things. It's so cool. But yeah, tell me
And
about this.
and it goes with the manual therapy for sure because neck, eyes, ears kind of piggyback off of each other. So I do use some of the objective measures to see, okay, what is a little bit off. I mean, so I have a optometrist, like sometimes the optometrist will refer to me to clean things up. Like if we can clean up the neck, sometimes they won't even need the vision therapy because it was coming from the neck. Of course, it depends, right?
Right.
Sometimes you need an optometrist or a neuro optometrist in the mix, but I will do foundational stuff like gaze stabilization, sometimes some eye stretches, eye massage, do vestibular therapy. I don't actually see that much BPPV. I know it's like prevalent, but I will say it's really rare. Like 1 in 100 people will actually have a crystal that's been dislodged. Usually, I want to say for me, but also it's what I look for is like the eyes and the neck. And then the vestibular is less on my radar. But then there are therapists where the vestibular is more on their radar. So that's, I guess, where collaboration comes in. But I feel like if there's not a crystal dislodge, if you fix certain parts of the triangle, it's going to bring the other part of the triangle up as well.
Yep, that makes a lot of sense to me. And they are, again, also interconnected. And so it's hard to tease it out, but also you're right. If you help, quote unquote, fix one, then it can help with the others as well. So that's
also like support. The body is self-healing, self-regulating if you push it in the right direction. So I think that always helps the clinicians be successful.
Yeah, thank you for saying that. I feel like that's just a message everybody needs to hear. Like the body wants to heal too.
Yes.
Like it's your partner in this. It's not your enemy. And I think that's a point that can get confusing, and it totally makes sense because it's the thing that's hurting so badly. But I know I talked to someone who had this mantra that was like, I don't remember exactly what it was. It was so sweet though. It was like, my body is my friend. My body is my partner in this. Like we're together in this. And I think that I appreciate that you brought that up. So thank you.
I love that. Like mantras that nurture yourself instead of bring yourself down.
Yes. Amen. And just to like remind that healing is what the body wants to do. So seeing the right people, doing the right things, that's all going to help towards that. But the body is the main thing doing it too is pretty awesome. Did you want to say anything else about that?
I was just going to say, I always tell people, you're doing the work. I'm just, I'm the coach, I'm the guide. I'm trying to give some direction to this, but it's their body that's doing the healing. It's not like we're not actually, right? We're giving them that.
Yeah. So true. So true. I love that perspective. Yeah. Thank you for sharing that. It's such a good point. And okay. And then your last point on that post that you had pinned was the collaboration. And I guess we kind of talked a little bit about that, but is there anything else you want to make sure people are aware of or know about collaboration?
I feel like we probably covered it. I mean, I think as a practitioner, so it's more from the practitioner side, but it's really important for you to find who your collaborators are, because then you can take some weight off of the patient. If you're like, okay, actually, but I know this great physician who I can link you with that will be able to help you, like a concussion-wise physician or physio, that can be really helpful because healing is a full-time job. So anything you can do as the clinician is going to just help essentially that healing process.
Yes, so true. And I think too, just the fact that collaboration is on your list, I think is so important because I don't know, sometimes people want to just be one and done. And I don't blame them. Like everybody wants that. But it's just good to remember, okay, this is a journey, this is a process, and you may have people that come in and out of that and along your way. And that's not only not bad, but it's actually a really good thing.
Yes,
So,
yes.
yeah.
And I think sometimes you really do need a fresh pair of eyes. Like I have patients that I plateau with, and it's like, okay, there is likely something else I'm missing because they're not better. So I need them to see somebody else. I need a new set of eyes. We've reached our maximum, movement in our relationship, but there's still more healing to be had. And it
Yeah.
doesn't mean anything against me or against the patient and what they put in. It's just, like I said, we're a collection of injuries, but also as you're healing, you're a different person every day. Right.
Yes.
So, yeah.
Such a beautiful point. Thank you for sharing that. Yeah. And I think it has come out as we're talking, like I can feel your passion and like and joy in what you do. But is there anything that you like particularly love about what you do that you want people to know about? Like about your job, about how you do what you do?
Well, it's really fun, I will say. And I think that is one of my superpowers. Like on my reviews, one person wrote, Melissa somehow makes one of the most difficult times in your life fun. And like, I will remember that for the rest of my life because it's like I said, healing is hard enough. So anything you can do to bring some fun to the assessment or just your environment, I think is helpful. So make it playful. And then, or that's one thing I love about it. And just seeing people like get their lives back for sure. And the
Yes.
other thing is, I always start with making or asking people to report their wins since I saw them last. And I love how people like embrace it. Like, I think it's probably the most important part of the appointment. It's just like, they're like, okay, I have my list of wins. And it's just so great to see people like embrace their recovery.
Yes. Oh my gosh. I love that so, so, so much. And I think that's like, not only is it helpful in that moment, but like, because they know that they're going to be reporting on it, that's like helping them tune their brain to focus on that and see those and record them and remember them so that they can report them and have someone to celebrate with. I love everything about that.
And sometimes people, because in the moment you might think, well, I'm still not better. So it's important to be like, okay, but wait a minute, like 3 weeks ago, I couldn't even stand without losing my balance. So the win is, oh, I could get in, reach to the lowest shelf in the fridge and I didn't get dizzy, or I went for a 10-minute walk and it actually wasn't too bad. So I think it helps you mark, okay, no, I'm getting there.
Yes, I love it. Thank you. Thank you for sharing that. And kind of along those lines, but maybe on the opposite side, what do you tell people when they are feeling like they're having a setback? And that's something that I have a friend who I adore her. She's somebody that I met through as a client through my job that I work at. And she was saying how she loves listening to these, but something that is really hard is that she's like, okay, I feel all this positivity and that's great. But when I'm in the middle of a setback, that's not always the most helpful. So when people are in it and they're like, it's really hard to see those wins, like what do you tell people in those moments?
And I think it's human nature because, like, if you have a breakup, you just want to listen to sad music
Right.
and watch the most depressing movies that you can find, right? You want to cry. And I
Yeah.
think it's the same when you have a setback. It's like, even though it's negative, we kind of want to amplify the feelings or reinforce them. So I do set people up in the beginning usually and say it's going to be like a roller coaster. Just like if you sprained an ankle, right? Maybe you're going to push a little too much, go for a run that was a little too long, and then the ankle's not going to feel too great. But then you're going to get back on track. And I know that doesn't necessarily make the flare any better, but just letting people know that, okay, but we're going to get back on the horse, and you felt better, or you felt 80%. So we know you can feel 80%. So even though you're back at 50 right now, it's time limited. And try and remind them of their strategies. They probably won't want to write down their wins at that exact time, but can put that in, or just some gentle, the mindfulness, the coloring, anything they can do that might be distracting or a little bit fun. Try and do that.
Yeah. Thanks for sharing those things. I think too, you're like, I like your point about even if it's not a setback from a brain injury, but just anything that's hard, we're like, oh, well, like our brain wants to kind of catastrophize and be like, all is lost. Like we tend to go there.
I'm never going to find another boyfriend or girlfriend or whatever, right?
We want it. And it's okay. I think to just like normalize and validate that as well. Like, of course your brain goes there. That's okay. That's like a human thing to do. So it's not a bad thing. And it doesn't say anything about your moral character or anything that if you're feeling that way. It's okay to cry. It's okay to listen to the sad music. And like, sometimes we just need to process through those, and those strategies help. That's why people do it, right? Like, so we just don't want to get like stuck in that for too long, I guess, is maybe.
I think like acknowledging this sucks. This day or this week absolutely sucks. But then that's probably a good time to book with like your most positive practitioner to help pull you out of it. Because there's a good chance you'll maybe wallow in it, or not wallow, but you'll suffer a little bit longer if you don't get back on, say, okay, today's the day. I'm pulling up my socks. I'm going to see, I'm going to see Shelley. And she's going to help me.
Yes. Perfect. And that's what I think is so nice about, well, like what you said, your patient, wrote on as a testimonial that you were so fun to be with. I think that energy, like we do think we can impact each other. And so even if you're not feeling it, if you're like around somebody who can maybe help you bring you up a little bit, that can be helpful too. And I like what you said too about the hope that this isn't going to last forever. Like it's got a timestamp on it, and it's going to improve. I think
absolutely. And I think, like I said, the body is self-healing, self-regulating. It does need some help, but your body wants to heal. I think with a concussion, we know your brain is using so much energy to heal. So sometimes it can be slow, but time will heal somewhat. But having a map is going to potentially make it a little bit quicker, more linear.
Yes. And having that external help, like you said, the body does want to heal. Sometimes it needs some direction and some external help along the way. So
it's a GPS.
Yeah, exactly. So do you have any, what advice do you have for loved ones, caregivers, somebody who's watching someone that they care about struggling with post-concussion symptoms? What do you say to them?
I know it can be very hard on the caregiver, especially if it is, persistent concussion. Sometimes it goes on for years. So I would say, sometimes as a patient, you need space. So don't be afraid to give your loved one space if they need it. And also the other thing is believe what they're saying, right? Because the worst part of concussion is that it's an invisible injury. And some days they're going to look great on the outside and not be feeling so great on the inside. So believing what they're saying, giving them space. And I would say even trying to bring the joy into situations. So kind of like when I'm saying in the office, I like it to be playful. But if you can think of activities that are low stim, that are going to put a smile on your partner's face, it's the little things that will matter.
Beautiful. Thank you. Thank you for sharing all of those. Yeah, I think it's important.
The other thing though is take space for yourself, right? Like being a caregiver, your battery is also being used. So don't forget, like care for the caregiver is also important.
Yes. Amen to that.
Can't give from an empty cup.
Yep. So true. And your system as a caregiver needs to have that relaxation and all of the things as well. So yes, exactly. Very, very true. Thank you. Anything else that you want people to know about concussions that we haven't covered yet?
Well, one thing is never compare so I have a love-hate relationship with the online community because the only people, or like 98% of the people who are still in the groups are the people who have not recovered. So I always tell my patients, you have to remember there's hundreds and thousands of people who've recovered, but they're not posting anymore because they're living their life. So for anyone who's getting support from the online community, that's great. But remember, there are so many people who have recovered. So you can be one of those people too. And the other thing is, I know it can be attractive to just try some exercises that worked for your friend or that have a lot of likes on YouTube, but those might not be the ones you need. And so I would say it really is helpful to get ones that are appropriate for you. Like if you're doing eye movement exercises that are opposite to the ones you need, that's not going to be helpful. I know people love to do those pencil push-ups, but I remember I had a patient come in who, which is where you bring the pen in towards your nose and let your eyes come together. And he was doing those, but he needed the opposite. And I was like, oh, this is a good example where you're just not the same as the person next door necessarily. And so embrace that. Your recovery is going to be different.
I love that. I actually really do appreciate that perspective and how helpful it is to have, again, an outside set of eyes that can who know how to help people with concussions that can come in and help. So if people wanted to get help from you specifically, how can they do that? Tell us where they can find more information about you.
All right, so most of the action happens on Instagram, and my handle is concussionrehab.ca, which is pretty easy. That's also my website. I'm in Toronto. I do some virtual stuff depending where you are. I can always consult or refer you to someone in my network. So definitely people can reach out in any of those ways, and I will either try and help or connect you. Love to chat concussion.
Right? I know. It's so fun to connect with other people who are as passionate about this as I am. So I love what you're doing, and I'm so grateful for you sharing your wisdom and inspiration and experience with us today. So thank you so much for being here.
Thank you for having me. This has been fun.
I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website. And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.